I'm doing research on bone defect treatment. I was working on bone tumor removal as an orthopedic surgeon in training, and during the time I realized that our conventional treatment methods for bone defect treatment are insufficient. During that time in the university hospital where I was working, we, for the first time at that hospital, implanted biodegradable implants, so-called scaffold-guided bone regeneration, which was pioneered here at QUT with Professor Dietmar and Dr. Marie-Louise Wille. And I thought I'd like to learn more about it, and I met Dietmar and we decided that I could come over and do research on it. I can show what a bone defect looks like that we have successfully treated here at QUT, or at least we provided the scaffolds for this defect that you can see here. For example, you see this is it was a complex fracture after an accident, and it didn't heal in a proper way, so it was biomechanical unstable. And what our interdisciplinary team then at QUT designed was this so-called scaffolds, the biodegradable implants, which are made of plastic, and they degrade over 2 to 4 years. We avoid that we have a foreign body in our bodies. And these implants are patient-specific, so they perfectly fit the defect void, and can be also modular, as you can see here. And for these implants we now have published promising results showing that we can regenerate the missing bone void. What I'm really hoping for the next 10 to 20 years is that we can further improve the implants with coatings, for example, as well as combining them with other drugs, for example, to treat cancer patients, so that we can reduce recurrence rate for bone tumor. So what we've implanted so far is a standard layering design. It has large pores. Using more advanced printing capacities are able to print scaffolds that can better mimic the bone architecture. And by having a better bone architecture in our initial scaffold design, we think we can regenerate bone better, and that's also what we see now in our first in vivo studies. This scaffold-guided bone regeneration includes using bone graft harvested from the inner canal of long bones in combination with biodegradable implants. When you look at the bone graft collection, or mainly we use a device which is associated with aggressive reaming, as well as using a lot of irrigation fluid. Thereby we might wash out cells as well as growth factors from the bone graft. So in collaboration with an industry partner, we are now developing a novel device operated by a suction only that efficiently removes bone marrow from the inner canal of the long bones, as well as having a less aggressive reaming approach. We do not have the washout effect because we are not using additional saline during harvesting bone graft. The bone graft that we harvest with our novel technology showed a high capacity to regenerate bone, and we see really high protein content using our scaffolds. So the blue color you see, that are the original bone chips, which are all alive, and at the border of the bone chip you see that new bone is laid down and can form and integrates well with new tissue formation. Our scaffold integrates well in the tissue, as well as keep the bone graft alive. And also we see here formation of new blood vessels is fostered by the scaffold, which is a guiding structure and a template for neovascularization, which is important to keep the bone graft alive, as well as to facilitate new bone formation. Why I decided on surgery is I see the direct effect of the things I'm doing. Then when we do surgery, we take x-rays and then we finish, and afterwards we have a direct result of what you have done. What I like most working at QUT and working with my supervisor team, but also with other colleagues, biologists and with engineers. What I honestly learned here the last 3 years is that we only can become better if we work in an interdisciplinary team. And by working in an interdisciplinary team with engineers, biologists as well as clinicians, we can develop implants that in the end will help patients.